So let us begin with Camphora and secale core today as a continuation of our Allen's keynotes study streak, which we have been doing in the last 40 odd days. Yesterday we discussed two remedies which were very integral and acting on the circulation and the nervous system and the gastrointestinal system. Today we'll discuss Camphora and secale, which also have its action on circulatory system but also on the other areas of the body, especially the GIT and skin. So thank you for joining Dr. Dureshevar, the free spirited girl, and we have some regulars, which is I think Dr. Kushi Patel was also there. Some people are there on YouTube. So let's begin the journey of Camphora and secale core. Camphora, we see that the first thing mentioned is mentally weak and irritable, but that is just one part of the entire mental symptoms that we see in our source books. So we cannot rely on this, and as I told earlier, and I have been telling in various other sessions, for interpreting mental symptoms and going deep into mental symptoms, Allen's Keynotes may not be the right book. There are many other books which will give you a good insight into how you will get to know the mind of the all the remedies in detail, and in future I'll take it up individually or in groups. But today and in these last 40 days, what we are trying to cover is that what are the physical generals and physical particulars. This is what is actually what the patient is going to land up in your clinic with, and those will be your prescriptive pointers, your indications for thinking about the remedies. Rest all things what you will decide on the basis of mind will be interpretational, and it will be variable from person to person, but you cannot change something that is physical particulars, and that is what Allen will share in his Allen shares in his entire book. Let's go further. In Camphora we have pains better while thinking of it. Helleborus is another remedy. If the pains are worse by thinking of it, it is Calcarea phos, Helonias and oxalic acid. So this is a very difficult modality to pick up, and I have at times came over to these modalities by confirming the remedy. So patient has told me that there is more of coldness of the skin, gastric disturbance, there is cold perspiration, some past history has happened in the life of the patient, and if I am thinking of Camphora, I will ask him whether thinking of the complaint aggravates your complaints, thinking about the pain, thinking about any complaint. Then it is that you get the confirmation that this is Camphora, or maybe sorry, not Camphora, it will be Calcarea phos, Helonias or oxalic acid, and if it is better by thinking of the complaint, then it is Camphora. Most of the times you will get the modality that patients are aggravated by thinking of the complaints, but you will get it as a confirmatory symptom rather than a direct and symptom which is mentioned by any patient. So pains better by thinking about it, Camphora and Helleborus. If they are worse, it is Calcarea phos, Helonias and oxalic acid. So most of the times I have given Calcarea phos and oxalic acid at times. Persons are physically weak, so if you imagine a Camphora person, it is just like carbo veg, except that the carbo veg is hot and Camphora is cold. Carbo animalis is cold and Camphora is also cold. So in that way you can make comparisons, and by comparisons you will be able to understand why you need to prescribe this remedy and how. Exceedingly sensitive to cold air. Hepar is one of the top remedies we have in our Materia Medica. Another remedy is Sorinum, and Calimure is the third remedy. Camphora also is one of the remedies. Surface is cold to touch yet cannot bear to be covered, throws off all the coverings. So there is a person who is feeling very cold objectively, and if any other person tries to check him, and yet the person is not taking coverings in spite of the relatives or the people around him telling him, that is actually Camphora for you. And you will see that there is more of similarity in Medorinum and secale core. So I have already discussed medorinum at depth in the Alan Skinner's study stick in the earlier days, and you can think of all types of patients who are psychosomatic in nature, who have their diseases which are psychosomatic in origin. It's like a thuja, but both are psychotic remedies, but both have their own characteristic symptoms, and that is why medorinum will mostly be thought of in the current age where people are more getting involved in their diseases due to psychosomatic problems rather than the external factors. Going further, in Camphora we have bad effects of shock from injury. Surface of the body is cold, face is pale, blue lips, livid and profound prostration. So this remedy was widely employed by many homeopaths in the COVID period, and you know what happened in COVID. Everyone was dead scared, like as if someone is knocking on your door about to kill you. That is the state of Camphora. So if you understand and if you have the access to how Dr. Sankaran came up to this understanding of Camphora as a genus epidemicus for the entire population on earth for COVID period, you will be delighted. It was circulated widely. You will find it online anywhere on most of the sites, and that is the state of Camphora. It is someone who is in sudden shock and doesn't know what to do and becomes nervous and collapses immediately. Tongue of the Camphora patient is cold, flabby, trembling, great coldness of the surface with sudden and complete prostration of the vital force, often a remedy in congestive chill, pernicious, intermittent, like the remedy Veratrum album. Pulse is weak, externally small, scarcely perceptible. So you will have many books which will give you all these details about pernicious fevers and chill which is congestive and fevers which are intermittent and remittent and what not. But in your clinic, when you sit with the patient, when you are taking a case, there is a lot of confusion, and what is mentioned in the books is exactly opposite to what the patient will tell you. And how will you interpret those things? I am taking that in the fever workshop. Patient will come and give you 10 symptoms. Whether those symptoms should be taken from the fever chapter, whether those symptoms should be taken from the chill, from the sweat. Are you really confident of handling fevers? I have had my struggles in my early days with fevers, and then I went back to failures, studied all the literature, came up to a theory and hypothesis that this is how the homeopathic doctor should take a case. And if you want to improve yourself in fever cases, you should join this workshop. Otherwise, you always have paracetamol, you always have crocin, you always have the nearest allopath just a call away. They will treat those cases left, right, center. They will see thousands of patients a day. They will not claim on social media, but we need to claim because ours is a art and science, and we need to treat every patient differently. So in Camphora we have fever symptoms mentioned, especially of the chill state, but how will you find it in the clinic? Those things need to be studied, and that is what I will be taking in the fever workshop. Going further, in Camphora we have gastrointestinal symptoms which are sudden attacks of vomiting and diarrhea. The concomitant being nose is cold and pointed, anxious and restless patient who is having skin and breath cold, like the remedies Veratrum, like Jatropha. So, it's a combination of arsenic, it's a combination of tobacco and Veratrum. So I study remedies in this way. For example, when I undertook Sanicula as a study, and I was never prescribing Sanicula in my clinic, I found something interesting, that it has some features of chamomilla, antimcrude, senna, tuberculinum and natramur and sulfur. That is where I should think of Sanicula. So in my normal repertory sheet, all these remedies are coming as a top 10 remedies. But Sanicula is nowhere to be found. It will not be found because it was not proved that way. The symptoms didn't come out in that way. But it is a combination of having the features of all these remedies. Similarly, for Camphora, you will see that it is a mixture of the acute state of gastrointestinal tract of arsenic and secale core, or arsenic and veratrum, and tabacum as a skin symptoms which are cold to touch and the skin is very cold in examination. First stages of cholera morbus and Asiatic cholera, severe and long lasting chill is veratrum. I had a very interesting case. This was like say 10 years ago when it was the early days of my practice, first 5 years, and it's been now 15 years since I'm practicing, 15 16 years, and in the first 5 years it was a struggle because you need to develop confidence to treat acutes, fevers, all these things. And one such case of chilliness, just the chilliness phase landed in my clinic and I didn't know what to do. It was just the feeling of cold throughout the day. There was no specific time modality, but just the feeling of coldness throughout the day, chilliness throughout the day. Body was extremely cold to touch. The mother was telling that, doctor, please check, the patient is having maybe fever internally. And there was nothing found on examination. The body was cold, the thermometer didn't show any temperature, but there was chilliness constantly. The patient was not so well covered, it was quite open. In those cases, we should think of Camphora. I gave Camphora 1 ml every 1 hourly and I saw the result in 6 to 8 hours. The child was totally free. A 10-year-old child not taking covers, which he should voluntarily take, at times patients do take, and just feeling chilly all the day long without any other symptom existing led me to prescribe Camphora, the skin being cold to touch. So in this way there will be different presentations in fevers. If you wish to learn and excel and add to your knowledge, you should join the fever workshop. Next you have is the skin, which is in Camphora having measles and scarlatina. Both these complaints are non-existent right now, but there will be different presentations of these complaints somewhere in the nature which we keep encountering, like the influenza virus also keeps on mutating every year. So in this way the skin complaints will also try to transform them into better versions, and that is why over here Camphora will be employed, where the face is pale, cold, blue, Hippocratic, and child will not be covered. So you see that it is mentioned second or third time that the child does not want to be covered or throws off all the coverings. So when something is mentioned in a series of repetitions, you know how important it becomes, and that is what will reflect in your clinic 10 times, rather than focusing on a mental general which can be misleading you. You should focus on physical particulars and physical generals, which will give you the strong foothold to prescribe, and taking covers or avoiding covers would be one of them for Camphora. Next you have is all sequelae of measles. Measles, the eruptions have not come out properly or some issues have happened. Camphora need to be prescribed. For modalities of Camphora, we have amelioration from thinking of existing complaints, warm air, and drinking cold water ameliorate. So person is cold to touch, yet he wants cold water. That will be the characteristic of Camphora. And it nearly antidotes every vegetable medicine, so maybe preferably we should avoid giving it if the patient is also in the treatment with us for some vegetable source of medicine, or its crude form will affect the dose of the medicine, so that should be avoided. Next you have the comparison, and in comparison you see carboveg, opium, veratrum and secale are very strongly mentioned. So next remedy of course we are covering is secale core. So Camphora for you, it is in clinics it will be presented in cold skin, number 1. Number 2, they will try to throw off all the coverings, and number 3, desire for cold water. And if they focus on the complaints or think about the complaints, they will feel better, which is quite opposite of calcarea phos and oxalic acid. Next we have is secale core, a very less understood remedy. It is like arsenic. It will come with arsenic in all the rubrics. One of the cases which I cured long back of gangrene was having secale core as the top running remedy with arsenic, but just the ability to cover or throw off the cover decided in the favor of the one of the remedies. So let's see what the remedy was. Secale core is adapted to women who are thin, scrawny, feeble, cachectic appearance. So thin lady who is, almost on the verge of emaciating or collapsing. Irritable, nervous temperament, pale, sunken countenance. So now when you read all these remedies, I don't know how many people were part of my sessions, Island's keynote session so far. And if you want to study Island's keynotes in a clinical way, then you should go back to all the recordings and find out that I have added some annotations on each remedy wherever I have shared those remedies. Now what I come to a conclusion, and what you will see is really beautiful, that if a person is having a nervous and irritable temperament, he or she will normally be emaciated. Persons who are plethoric, persons who are fat may dispose to be lousy or lazy or not able to throw off their emotions because everything keeps on getting collected. So what you should do in your clinic, when the patient enters, you should actually see their constitution and make a note of it. Whether the patient is thin, fat, whether he is obese, whether the body is thin, upper body, lower body, and based upon that you have your Allen's keynotes. It's more than enough for a guide to draw conclusions for you when you come to the remedy at the end of the case. So when you will see all these things, and if you have read Allen's keynotes multiple times, you will see that there are some remedies which will work on, or which is predisposed to work on people who are fat, who are thin, who are having upper body thin, who are having lower body thin. In this way you will be able to give leading questions to patients at the end of your case taking, and that will lead you to deciding on a remedy. Because what is one of the major impediments for a homeopath? Taking the case, you learn from somewhere. Taking rubrics, you learn somewhere. But deciding on a remedy is one of the biggest challenges. And for that to learn, you need a bit of artistic ability and ability to think what is your basis of prescription. Is it thematic? Is it physical particular? Is it physical general? Is it some chief complaint? Is it mental general? What is it? If you are a student of Allen's keynotes, you will probably be happy with a constitution and some physical particulars to guide you to your success, rather than getting confused in multiple things which are available everywhere. Next you have is for secale core, very old, decrepit and feeble persons. So people who are very weak in their mind and their body will be mostly secale core for you. Women of very lax muscular fiber, everything seems loose and open. There is no action. Vessels are flabby, passive hemorrhages, copious flow of thin black watery blood, and corpuscles are destroyed. So we discussed yesterday veratrum album, veratrum viridi, where everything was kind of in confusion. There was circulated distress, the body was cold, the pulse was irregular. Here also you have some aspects of veratrum where you see that the blood corpuscles are destroyed and the circulation is not in proper sync with what it should be normally in a normal physiology. There is hemorrhagic diathesis, which is what we see in phosphorus as well. The two remedies mentioned for hemorrhagic diathesis in this comparison are lachesis and phosphorus. And the slightest wound causes bleeding for weeks. So secale core is some remedy which will not be the first prescription of thought for all homeopaths, because of the complexity in understanding the remedy and in the complexity in understanding the patient. So you will think of, say, arsenic, some parts of arsenic, you will think some parts of phosphorus, you will say some parts of carbovage or camphora are there. Then it is that you should decide that secale core should be given. So let's proceed and see about secale core, how it will help you to prescribe, how it will be clinically seen. The next thing that we see mentioned is discharge of sanous blood with a tendency to putrescence. tingling in the limbs and great debility, especially when weakness is not caused by the previous loss of fluids. Unnatural ravenous appetite, even with exhausting diarrhea, craves acids and lemonade. So it is very rare in clinical parlance that you will come across patients who will tell you that I want lemonade or I want fresh juices per se. In those cases, think of veratrum, think of phosphoric acid, think of pulsatilla. There are just a handful of remedies, especially in Kent repertory. If you stick to that, there is a rubric, desires, refreshing things. There are very few remedies. So in this way, you should make your own chart of remedies and think when to prescribe, what to prescribe, rather than being just confused with lot of methods. Homeopathy is pretty simple. You should stick to some physical generals, physical particulars, and one mental general which should guide you to the prescription, and not get confused with obtaining too many mental generals from patients, because it will lead to interpretation. With the entire coldness that we see in secale core, there is also the mention of burning in all parts of the body as if sparks of fire were falling on the patient, which is also what we see in arsenic. Next you have is skin is cold to touch, yet the patient cannot tolerate coverings. Icy coldness of the extremities. So we see also the same thing in Camphora, and we see this also in veratrum album. Tabacum as well. Face pale, pinched, ashy, sunken, hypocritic, drawn with sunken eyes, blue rings around the eyes. So someone who is on the verge of getting hospitalized, those cases will make you seem to be fitting this constitution. Think of secale core in that case. Diarrhea which is profuse, watery, putrid brown, discharge with great force. Gambogia and Crotalus horridus. Gambogia is very frequently prescribed. Crotalus horridus may be less prescribed, especially for diarrhea, except if it is having hemorrhagic diarrhea, then we are thinking of it. But we can think of it when such situations also exist. And it is very exhausting, painless, involuntary. Anus is as if wide open. Same presentation we saw in Apis and Phosphorus. In fact, in Phosphorus, one of the strong prescriptive pointers for you would be that patient is not having a formed stool for a long time. You can check with the patient if you feel that he belongs to a phosphorus constitution, and you can ask him if the stools have been kind of loose since the last few days. In those cases, think of phosphorus. Similar presentation we see in secale core, and there is anus wide open, or there is kind of a involuntary painless discharge from the bowels. Next we have collapse in cholera disease. Skin is cold yet cannot bear to be covered, like the remedy Camphora. So very close running remedies. Then you have gangrene, which is dry and senile gangrene aggravated from external heat. So one of the cases that I saw, and I have been presenting that case in various sessions in different colleges, in different seminars wherever I go, that the patient was a pretty old man and he was sitting on the ground, but he was sitting under a fan, and although he was sitting under the fan, he was having his leg, which was almost gangrenous, he was having it covered with a handkerchief. And I asked him, why are you doing so? He told me that this air I cannot tolerate. Based upon this, I gave him arsenic. Otherwise, I was almost thinking of giving him secale core, because the parts had already turned blue or black. So if you are following me on various social media platforms, maybe sometime in future I'll post that case again. It's been a long time where I keep sharing these cases in different sessions wherever I go, but I'll post this sometime on the various social media platforms, so that you are aware of how you should prescribe. And the beauty is that I was only touching Bogart's synoptic key back then, because that was the only book which was the thinnest book I could carry in my bag with all the medicines that I could, and it had materia medica and repertory. So it has its own advantages, and maybe if you are associated with me for a long time, you will get to learn Bogart's synoptic key in the near future. Next we have is large ecchymosis in secale core. in Allen's keynotes, blood blisters, often commencement of gangrene, pulse rapid, small, contracted, and often intermittent. You have enuresis of old people, urine pale, watery or bloody, urine suppressed. So it's not a first remedy of thought for nocturnal enuresis in old age, but you can think of this remedy if the other physical particulars are pretty much in line with what Allen says and other book says, which is the coldness of the body or the appetite or the craving for acids or lemonade, something like that. Then you have leukorrhea, which is green, brown, offensive, menses irregular, copious, dark fluid with pressing, labor-like pains in the abdomen, continuous discharge of watery blood till the next period. So people, especially females who do not have their menses in a clear expelling nature, they should be given secale core. Also, it lasts for a long time, kind of lingering process. That should be secale core for you to prescribe. Threatened abortion, especially at the third month, the Sabina is one of the top remedies. Prolonged bearing down and forcing pains. During labor, pains are irregular, too weak, feeble or ceasing. Everything seems loose and open but no expulsive action. Fainting also. After pains are too long, too painful, hourglass contraction. Suppression of milk in thin, scrawny, exhausted women. Breasts do not feel properly. We saw this also in lac can and lac defloritum, some aspects of it. Asafoetida is also another remedy which will act on the milk. It will be excess or in diminished quantity. Here it is more of diminish in quantity, and you should think of secale core in such a case. So everything has been expelled from the body, nothing is remaining in the body, and what should naturally happen or occur, that is also not coming. The problem is in the normal way the organ should act, and that restoration will be done by secale core. Next you have on the skin boils which are small, painful, with green contents, mature very slowly and heal in the same manner, very debilitating. So, you should have your own set of remedies to prescribe in cases of skin complaints, especially of different natures, and especially if it is first stage of inflammation, second stage of inflammation, third stage of inflammation. You should first understand the physiology, pathology, and then correlate with the medicines which are present in homeopathy. The first level of medicine should be belladonna, it should be sulfur, it should be hepar sulf. Second level medicines, again hepar sulf, graphitis, mux sol, miserium. Third level medicines, kali bichromicum, secale core, sanicula, or calcarea picreta, arnica, those type of remedies. Why? Because they kind of are involved, the later remedies, the second and the third stage remedies are more involved in causing a stasis, and that kind of does not help to drain the fluids from the abscess. The lymph is not working. These remedies will work on that area and will kind of drain. Calcarea sulf is also another top remedy. So you have aggravation from heat, from warmth, from covering affected parts. When they are covered, the patient cannot tolerate. He wants to uncover all the time. Worse from heat, and amelioration from cold air, getting cold, uncovering, and rubbing. So secale core is a remedy which you will think of in cases where you feel that arsenic has it, the patient has symptoms of arsenic, carbo veg, and kind of, or a cold carbo veg, which is carbo animalis, and tabacum or veratrum like cases. Normally homeopaths don't come to this remedy as a frequent prescription. It's a very bad precedent, because we are always telling the world that we should be unprejudiced, but we often get prejudiced, and to release these prejudices from our mind, we need to read books every day. That is the only way forward. Otherwise, wherever you are, you stay stuck in that zone for 6 years, 8 years, 10 years, 20 years, maybe your life ends. But if you read every day, you will develop a newer perspective towards the same medicines that you have read yesterday or last year or maybe 5 years earlier. So try to read every day, and in this way you will come to prescribing secale core, which is very less prescribed. So meanwhile we come to an end to the remedy secale core. We covered two remedies, Camphora and secale core, and I hope it gave you a brief idea of how you will see it in clinic and what will be the clinical relevance. And I am having an upcoming workshop on fevers. If you wish to join and learn, develop the confidence to hit the bullseye in your clinics, don't miss this chance, because once the workshop is over, the rates are for the recording will be more than double. So try to access the recordings and develop the confidence that you need to get right away in your practice. Any questions, please feel free to drop in the comments of Instagram or YouTube, and I will be glad to answer. Or if there are no questions, please let me know how you feel from the sessions, if you have been regularly attending, or how you felt after attending today's session, and we make a move. So Dr. Sailesh Kumar asking on YouTube how to register for the fever course. You can write down the number. It is 9975461833. I will pin it in the chat also of YouTube under this video, so you can contact, you can WhatsApp it, and we will get back to you with the details of how you should register. And that's all. I think we do not have anyone else in Instagram or. Okay, Dr. Shailendra, very good sessions. Thank you for your comments, and I'm glad it is probably contributing in one way or the other to your already growing knowledge. So let's make a move and see you all tomorrow 5:15 with another set of remedies, and let us continue this Allen's keynote study streak. If you have attended all the past sessions of Allen's keynote study streak, you are a very good student. I think there are only a few people who are regularly attending, and I'm glad that it's difficult to continue a habit for more than 5 to 7 days, and if you are doing it on an everyday basis for 2 months, 3 months, 6 months, and an year, you are incredible, and that's what a homeopath should be. It's not a game of few minutes or few hours. It's a game of staying in the game for a long time, for decades. So if you want to be in the game of homeopathy for decades, you should read every day, study every day, and that's what a homeopath should do. So thank you, Dr. Sailesh Kumar, for your comments, and Dr. Rahul Raj. Yes. So lachesis and secale core in gangrene. What I intend to do is, Dr. Rahul, is that in future I will probably take two remedies and compare it. I'll be posting videos. So I'll inform. That's the next project that I'm working on, and the comparison will be right from the doctrine of signature, materia medica, repertory, and clinical relevance. That is what is the next step. But meanwhile, if you wish to see a glimpse of what I did, what I would be doing about these comparisons, you can go to my timeline and watch 3 summer remedies. I have compared 3 remedies: Kali bichromicum, Antium crude, and Sinapis nigra. You can go over that particular video, watch it, and get to know how it will be done in a more improvised way in the future. So since it's a less session for less time, and I cannot present it in the Instagram live and YouTube live with the PowerPoint, which needs to be done, so I'm not posting it right now. So Dr. Shreya Tamhanpure and Vital Healing, thank you for your feedbacks. And if you are a part of these sessions and earlier sessions, if you wish to see, you can go through the timeline and watch all the Allen's keynote study sessions. You will get an idea of how clinical relevance it is, how clinically relevant it is in your clinic. So that's all from me, and see you all tomorrow evening, 5:15 we start with the next set of remedies.